Today, we are going to give folks another minute or two to log in, and then we'll get started. Good afternoon. It's Jason Jones with the Community Technical Assistance Center, and I would like to welcome you to today's event, Applying Motivational Interviewing to Support the Coming Out Process for LGBTQ plus Youth. This is the first of our two-part series using MI to support LGBTQ plus youth and their caregivers. Before we get started, I want to take a moment to orient everyone to the WebEx system so you know how to participate in today's event. Please note that upon joining the webinar, you've been placed on mute to avoid any background noises that may distract others from listening to the presentation. If you come across any technical difficulties during today's event, please chat to the host who will be able to assist you. Early on in the presentation, you will have the opportunity to communicate with the presenter by utilizing the same chat box feature, which is located on the right side of your screen. Please address your entry to all panelists if the chat box feature is not visible. Click the dialog bubble on the toolbar at the bottom of your screen and it should appear. You also have the opportunity to submit questions for the Q&A portion at the end of the presentation. In order to ensure that we're able to answer as many questions as time permits, we are requesting that you send in your questions at any point during the webinar using the chat box feature and addressing all panelists. We are very excited to have with us today Dr. Brianna McGue from the University of Kansas School of Social Welfare. Dr. McGue's research focuses on understanding and intervening on mental health disparities experienced by sexual and gender minority individuals. She previously worked as a therapist for LGBTQ plus clients living with severe and persistent mental illnesses and substance use disorders at a community mental health clinic. Once again, thank you for joining us. I will now pass it along to Dr. McGue to get us started.
Jake, thank you so much. And it's such a pleasure to be with you here today. I'm looking forward to diving into this topic a little bit with you all. So big picture, the goal is for me to introduce some of the foundational principles and tools of motivational interviewing and think through how some of those tools could be applied to supporting LGBTQ youth. More specifically, we'll be discussing some of the foundational principles and tools of MI, understand how MI has been applied to serving youth and LGBTQ communities, understanding how MI tools could be applied to supporting LGBTQ youth with coming out in particular, and then applying these tools supporting youth deciding whether to come out or not. So I would love to get a little bit of insight from folks to tailor the presentation some. Folks would chat in, what are some worries or concerns you have in working with LGBTQ youth who are deciding to come out? We'll take a few minutes to let folks enter things in. So far, I'm seeing concerns about safety, concerns about family rejection, concerns about rejection from religious communities, managing desire versus safety. I have a client who's questioning, so it's unclear of if coming out is sort of the thing that sort of serves their next step in their identity exploration. concerns about maybe not sharing one of these identities and making the youth feel uncomfortable or unsupported, a lack of resources, homelessness, which often aligns closely with family rejection, mental health outcomes that can arise if not accepted by the community, how to engage family and youth with strong cultural beliefs and stigmas, cultural ramifications, accidentally being insensitive in the conversation. Excellent. So yeah, I think we seem to be channeling in on some of the absolutely critical and very real issues of concerns that an LGBTQ youth may come out and experience threats to their safety, either from their family, religious communities, school communities, their peers. And these are really well-founded concerns. And I think, unfortunately, things that we can try to mitigate through a variety of strategies, but things that are fundamentally the reality, which are what makes this process so challenging and delicate. But yes, thank you so much for submitting those, and we will be discussing sort of these topics throughout. So to start, just to make sure we're on the same page, I'm going to provide a few terms about sexual orientation and gender identity. So sexual and gender minority, as well as the term queer, are both umbrella terms used to refer to a broad spectrum of non-heterosexual sexual orientations and non-cisgender gender identities. Queer has a similar meaning, but often has a more political connotation, referring to trying to shift social norms. Transgender is someone whose gender identity does not align with their sex assigned at birth. Non-binary is a spectrum of gender identities that are not exclusively masculine or feminine. So often non-binary folks identify as something other than male or female. And then cisgender is someone whose gender identity aligns with their sex assigned at birth. In other words, someone who isn't transgender. So what is coming out? Coming out is disclosing one's sexual orientation or gender identity. And I think it's important to note that coming out is not a discrete event, but rather is an ongoing process that evolves with an individual's identity, relationships, and social environment. So folks don't just come out once, it's sort of an ongoing process. And the risks and benefits of that can really evolve over time, depending on where the client is living, where they're at developmentally, if they are, say, in a relationship or not, that sort of all of these factors, if they're financially independent, can really influence what the experience of coming out is like. So there are some real advantages of coming out, that LGBTQ individuals who are in the closet, so in other words, have not come out or concealing their identities, experience heightened risks of isolation, as well as increased risky sexual behaviors, often needing to resort to more secretive methods of sexual behaviors, which can increase risk for a variety of negative outcomes, including sexually transmitted infections. And then for many individuals, coming out can lead to greater feelings of social connection, often connecting with members of the LGBTQ community, feelings of empowerment and self-confidence. So there are a lot of perks to coming out for a lot of LGBTQ people. Unfortunately, as was highlighted a lot in our initial Q&A chat entries, there are also risks associated with coming out. So individuals who come out experience greater risk for verbal and physical victimization due to the oppressive society we live in. And for some, coming out is an experience that ends up being really stressful, characterized by either anticipating or experiencing rejection from all of the folks you'd mentioned. Parents, families more broadly, schools, peers, etc. So a key point here is there are a lot of benefits of coming out, but there are also a lot of risks. So it's a situation where there's not a clear answer of like what is going to be better or safer for your client. There are a few different models of coming out, and both of these were largely developed for gay men coming out as gay. And these models are from the 90s and 80s. The first of these is identifying oneself as different from the majority. In other words, the majority being viewed as heterosexual, exiting from that heterosexual identity that's just sort of assumed in our heteronormative society. And then creation of a sexual minority identity that is publicly known and acknowledged. Then we have a different coming out model developed. This one dates way back to 1982, and again refers specifically to the sexual orientation of gay men. Unconscious or conscious questioning of sexual orientation occurs in the pre-coming out phase. I think that's often referred to when folks say that early on just felt kind of different from other people. Coming out, the sort of acknowledgement of non-heterosexual attraction, disclosure of sexual orientation. Exploration involves experiencing and navigating the LGBTQ community and sexual and romantic relationships. So really sort of starting to explore how one connects with other LGBTQ people. First relationships involve experiencing and navigating intimacy and commitment. So these exploration and first relationship phases are often, I think, pretty similar to how we describe a lot of the developmental process of adolescence around relationships. And lastly, integration, this sort of establishment of desired relationship patterns, whether that be monogamous relationships, non-monogamous relationships, choosing to not be in a relationship, etc. So sort of the place where sexual orientation just becomes a bigger part of someone's lived experience and isn't necessarily something that they're actively processing regularly. Now, I want to highlight that I'm actually not a huge fan of stage models. I find them to be really useful to discuss because they provide insight into a range of the processes involved in coming out. The coming out is more than just telling people about your sexual orientation and gender identity. It involves how one connects with the community and sort of figures out bigger picture what one wants, and sort of broadly speaking, how one constructs one's life, often having to take into account who is and is not supportive in one's life. So I think it's really valuable to know that there are just a lot of things going on with coming out beyond just telling folks what someone's thinking. The reason I'm not a huge fan of them is, one, they're just really diverse experiences related to coming out. Like, I've known folks who have ultimately felt incredibly supported, and it was just like really great for them and overall didn't feel like they experienced overt stigma. And I've known folks who've had really awful experiences, have experienced sort of all of those things that you're describing in terms of bullying, harassment, homelessness, etc. It also fails to account for sort of the ongoing and evolving nature of the coming out process that, similar to the stages of grief, I don't think it's reasonable to think that like everyone goes through these like specific discrete stages in a linear order, but rather folks maybe have like integrated their sexual identity into their broader life, but then maybe realize that, oh, I actually maybe am trans in addition to being gay. And so now I need to disclose again, and that process might look very different. So big picture, I think it's helpful to realize there are just like a lot of components of coming out that can touch on multiple stages and experiences of people's lives, but everyone's going to have sort of a different experience. I also, like, someone in the audience commented that coming out must involve disclosure versus coming out, which can be self-acceptance. And we'll talk about this a little bit when we talk about the menu of possibilities. There are sort of a range of ways that coming out can look for someone, depending on their life situation and their goals. So here we're going to now transition to talking about motivational interviewing a little bit. So motivational interviewing is a collaborative, goal-oriented style of communication with particular attention to the language of change. It's designed to strengthen personal motivation for and commitment to a specific goal by eliciting and exploring the person's own reasons for change within an atmosphere of acceptance and compassion. That's a lot of words. So to highlight some of the big points, one, it's collaborative, a collaboration between the provider and the client. It's goal-oriented, so there's some sort of focus involved about some sort of change that someone's either considering or committed to making. And really important, it is intended to strengthen personal motivation by eliciting and exploring a person's own reason for change. So I, the clinician, am not going to try to instill change in the person, but rather try to get a sense of like, what is motivating them to want to make this change and trying to leverage that. Because the reasons that I maybe find persuasive are not necessarily the same things that the client finds persuasive. And then lastly, an atmosphere of acceptance and compassion. So a lot of this is focused, a lot of motivational interviewing was developed for substance use counseling, and there's a long tradition of highly confrontational substance use counseling patterns, and motivational interviewing is not that. That it's anchored at least partially in a more Rogerian humanistic style, so really trying to create an environment that is warm, comfortable, and accepting of the client. One of the primary goals of motivational interviewing is to help clarify and resolve ambivalence. And in terms of motivational interviewing, there are some just fundamental philosophical principles that are intended to underlie everything that a clinician does. Big important one, very important for this topic, is autonomy. So respecting what the client wants for themselves and their goals and what they think will work best for them. Collaboration, so working together. Compassion, warmth, empathy, all of those client-focused skills that we've all worked really hard to develop. And then evocation, the idea being that we want to pull from the client as much information about what they think will work and what they will want, versus sort of telling the client what we think will work and what we think they should want. And there are 4 primary processes of motivational interviewing. The first is engaging. So that's really trying to connect with the client, create a warm and comfortable environment, establish that working relationship. And then we have focusing, so where we really try to focus our attention on a specific goal or small set of goals. In the purpose of this conversation, the focus is coming out. Depending on what the client situation is, there could be multiple foci. Since motivational interviewing is well established for substance use counseling, if a client's also experiencing substance use counseling, you may have a couple of foci. One is maybe deciding whether to come out, and the other may be trying to manage, say, marijuana use or something like that. And you can often use pretty similar tools. Evoking, once you've identified what you want to focus on, pulling from the client as much as possible, the reasons they want to focus on that, a sense of what changes they potentially want to make or not, and strategies that they think will work for that. And then planning, that's actually the sort of action planning portion where one comes up with a sort of set of tools for actually putting the plan into action and implementing it. So motivational interviewing is also a balance of client-oriented skills and change-focused skills. Client-oriented skills being empathy, warmth, those skills that we use to really try to connect with the client, and then change-focused skills, a series of tools we can use to try to help the client make some sort of change in their life. In terms of client-focused skills, the big ones, often referred to as clinical micro skills, are often referred to using the acronym OARS. Open-ended questions. We want more than half of the questions to be open-ended. So who, what, where, when, why, and how kinds of questions, not yes or no questions. Affirmations, so positive statements regarding the client's efforts, strengths, progress, etc. Reflections, repeating back to the client things that they've said. Sometimes these can be simple reflections using more or less exactly the same words the client used. Sometimes they can be reflections that expand on what the client has said, sometimes overstating what the client said, sometimes understating what the client said to try to pull some sort of reaction and use the client's own words. Something notable about this is motivational interviewing really likes reflection. So I think traditionally in my clinical work, I've probably relied most heavily on open-ended questions, but classic MI does aspire for folks to use reflections twice as often as they use questions. So rather than asking questions, using statements that sort of highlight the key points of what a client is trying to say. And then summarizing, so that's trying to take together a lot of the content used big picture in a conversation and highlight some of the most important points. This can also be used to highlight sort of discrepancies or differences to sort of get some clarity about ambivalence the client might be having. It's also a very helpful tool for transitioning from one topic to another topic. So far, we've talked about X, Y, and Z. Now I think it might be helpful to talk about A, B, and C. And I think it can be a helpful transition tool because it highlights what a client has said, and so it indicates that you're listening and want to retain some of that information, while also segueing into perhaps a focus area for the session. So thinking about motivational interviewing in the LGBTQ community, and I think this is big picture, where I want to make the point that a lot of what we'll be discussing are things that are the application of motivational interviewing tools, but have not necessarily been empirically tested. So there haven't been any specific studies where these tools are applied with LGBTQ youth and outcomes are assessed. So this is more at this point in a theoretical stage of development. But I think that's actually pretty normative, unfortunately, for a lot of these more specialized mental health interventions. That I think there are a lot of things where we're trying to think about how to apply particular tools, and there's reason to believe that they might work, but that we haven't actually specifically tested them. So I've used a lot of these strategies with my own clients, and they've often seemed to be pretty effective, but I do want to be transparent that there's not like a specific tome of research that has sort of systematically evaluated this. But there are specific studies that have looked at motivational interviewing in the LGBTQ community and motivational interviewing with youth, and both have indicated some promising results that motivational interviewing can be applied to these populations. So when it comes to motivational interviewing in LGBTQ folks, generally speaking, it's been applied to adult gay men to influence health behaviors around substance use and sexual practices. So there's been a pretty close link between motivational interviewing and intervening upon HIV risk behaviors among gay men. And there's a fairly robust body of evidence that motivational interviewing has been useful and effective in reducing sexual risk-taking behaviors such as condomless sex and increasing safer sex practices. Some of the tools that have been used there involve a questionnaire that compares desired versus actual behavior. And again, it's very non-confrontational. So it's not like, oh my gosh, you messed up, you've done these terrible things, but does try to highlight what is the client's goals, how have they actually been behaving, to identify discrepancies there. And sometimes when folks see those discrepancies, it can be a tool for both identifying that those discrepancies exist and motivating someone to make a change, as well as providing some clarity about when slip-ups happen, and when these slip-ups happen specifically, and having specificity around that can be really useful for action planning about how to make a change. There's also we'll talk more about this in a little bit, but a menu of potential safer sex change possibilities, and we'll be discussing the menu of change as a strategy for identifying different changes that could potentially be made or different options for coming out. MI has also been found to be effective for reducing meth use among gay and bisexual men, completing a change plan, including identifying goals, barriers, and strategies, as well as people who can support change, and then reinforcing motivation and progress. In terms of MI with youth, MI has been found to be effective in reducing alcohol consumption, cigarette smoking among youth. It's also been applied to improving academic performance, reducing obesity, and medication adherence. But those have generally been trials of trying to apply the technique that haven't necessarily looked at outcomes. So there's not as much evidence either way about whether or not MI with youth is as helpful for academic performance, obesity, and med adherence. But it does seem to be effective in terms of modifying substance use. So now trying to get a little bit more specific, both in terms of the tools one can use and learning a little bit more about that, as well as specifically how those tools can be used to support the coming out process. So big picture concept here, equipoise, which is a clinical and personal situation when a clinician has no good basis for a choice between two or more options. And in other words, what this means is we've seen research supports that there are benefits of coming out, including finding community, feelings of self-efficacy, but there are also risks, particularly victimization, homelessness, etc. So it's not something that there's a clear answer about whether or not coming out is going to be helpful or beneficial for any given client. The other really important spirit of MI here involves autonomy. So again, supporting the client and making the choice that is right for them. And this involves explicitly honoring the client's right to change, helping the client to recognize the choices or decisions in front of them, expressing confidence about the client's ability to make a change if they want, and expanding the client's experience of their own sense of control and choice. So big picture, we really want to create an environment where the client can make the choice that's right for them in this sort of very uncertain world. So the first tool that I think is used in a lot of clinical approaches involves the decisional balance. So identifying the benefits and costs of making a change, so in this case, coming out, versus the benefits and costs of not making the change, so staying in the closet. So some things that can be particularly valuable in making this decision are some knowledge that you now have and likely came in with about the potential risks and benefits of coming out and indicators of the likelihood of each of these risks. So for instance, if a potential concern about coming out to one's parents is, say, physical abuse, if there's a history of physical abuse in the family, that increases the likelihood of that risk. General skills in supporting the client with decision-making, a lot of those sort of empathic, non-judgmental approaches are really important here. And then, again, sort of identifying and at times highlighting the risks associated with coming out, homelessness, potential victimization, loss of financial support, bullying are all some examples. And then most importantly, it's working with the client to identify the plausible risks and benefits for their own situation and particular life circumstances. I again want to highlight that no one can predict the future perfectly. So it is, often a kind of speculative exercise based on past experiences and things that they've observed. And just sort of affirm some of the discomfort with that uncertainty, which is unfortunately just a reality of this process. So motivational interviewing tool, the change menu can be really useful in navigating the decisional balance. I think a key element here is there are, as highlighted in some of the responses, a variety of possibilities of what coming out could potentially look like. So there's radical behavior change, which is the complete stopping or starting of a set of behaviors. So this could be just like, I am going to publicly come out to everyone. I may even do it in a public forum, just going to try to make sure that everybody knows. Incremental behavior change, which is a gradual change in a behavior. So maybe like I'm going to come out with a few people at first and sort of see how that goes and then make decisions about how to proceed. Attitudinal or perceptual change. So this is shifting the way one thinks about or responds to a situation without necessarily changing the situation. So an example here might be, I have decided that I'm not going to tell anyone about my sexual orientation or gender identity right now, but I'm going to think about that differently. That I'm going to think about this maybe as like a short-term concealment while I get through high school, and then once I get to college, I will start telling people. And I realize that that's the right decision for me because it will sort of ensure that I am living in a safer environment. Then there's making a decision. So maybe the person doesn't actually come out or not in a particular moment, but they make a decision about whether or not they're going to come out. And then lastly, accepting the status quo. So choosing, in this case, it would be, I'm just not going to disclose my sexual orientation to other people right now. So again, some examples: coming out to everyone, coming out to only some people, coming out in particular ways, maybe coming out in a public place, maybe in the presence of someone who you trust that might contribute to safety in the coming out process. And that once a few promising options have been developed, one can sort of fill out that decisional balance of the pros and cons for each of them to try to identify what seems like it maximizes the benefits while minimizing the risks. And then a note from Miller and Rolnick, who are sort of the patriarchs of motivational interviewing. When people perceive that they have freely chosen a course of action from among alternatives, they are more likely to commit and follow through with it. So I think it can be worthwhile spending a fair amount of time thinking about different possibilities because when folks choose from a range of possibilities, they're more likely to feel good about their choice. Another tool that I think is relevant in navigating this decisional balance is the elicit, provide, elicit framework. So motivational interviewing really tries to evoke or pull from the client as much information as humanly possible. But as clinicians, we often do have helpful information. And so it's also not responsible to just keep all of that to ourselves and be unwilling to share it. But again, we want to sort of promote clients' autonomy, and so we want to give them a choice if they want our hot takes or not. So the elicit provide elicit framework involves asking the client what they know on the topic. That's eliciting, asking permission to provide advice, then offering brief relevant targeted information, and then asking the client to evaluate the information or advice relevant to him, her, or them. So in other words, I'm going to see what the client knows about the topic already, ask if they want my opinion. If so, provide the most relevant piece of information, and then elicit from the client what they think about the advice that they received. So in terms of how this might apply to the coming out process, if a client is struggling to identify risks and benefits of coming out, the practitioner can, with permission, suggest some possibilities. And again, sort of you're aware of some of these possibilities. Benefits including increased connection to LGBTQ community, increased possibility for cultivating healthy romantic relationships and friendships, but also some risks in terms of increased risk for homelessness, financial strain, bullying, etc. Another place that one could potentially provide information is if the client is struggling to identify more than 2 options for coming out, often the come out to everyone or don't come out at all. The practitioner can provide some additional possibilities like coming out to some people, coming out in a particular context, maybe waiting to come out a little bit, etc., based on what seems relevant and helpful to the client. And then lastly, after seeking permission, one can advance additional information about the multitude of ways that the client can come out. And again, sort of always asking the client to evaluate this information for what seems most relevant and helpful to them and what maybe they don't want to consider further. So then we're trying to reposition to potentially actually making some sort of change. And some clues that folks are interested in making a change involve either preparatory talk or commitment talk. And preparatory talk often involves clients expressing a desire to make a change, like I want to make a change. Ability to make a change, I think this is something I can do. Reason, I need to come out for X, Y, and Z reasons. I need to come out because I want to find a girlfriend. I need to come out because I just want to feel more comfortable in my own skin. I feel like I'm keeping some sort of secret. It makes me really uncomfortable. And need, like, I just need to come out. Like I'm miserable in the closet right now, and it's really important for me to tell other people. And then so these are preparatory comments. So not necessarily that I've committed to this, but like I'm considering it and possibly even transitioning to like preparing to make some choices about whether or not to come out. And then commitment, commitment comments. I'm going to do this thing. I've decided this is what I want. Action. So doing things related to coming out, so possibly even just telling people about one's sexual orientation, or taking steps, maybe sort of writing like a script about like what one might say to their parents if they come out. So commitment is like they're actually starting to like move towards the process of actually doing something. And then an important question that can be helpful here is, given what we've covered, what next step, if any, makes sense? And this is a really helpful way of just getting big picture a sense of where the client is at and how they want to proceed. And sometimes the answers to this might be, I just want to think about this a little bit more. In other cases, it might be, I'm really ready to like tell my best friend. And then based on what they say, coming up with more specific strategies about how to actualize that next step. And this really transitions into the planning stage, that third stage, or that, yeah, fourth stage of motivational interviewing. If a client appears to be ready to decide, plan, or commit, one, elicit greater specificity, how, when forecasting how to handle obstacles, what if situations. So a lot of those tools related to like SMART goals, just getting a lot of specificity about like what the client wants to do, in what context, when are they going to do it, to make sure that everyone has like a clear understanding of what the plan is. This one feels maybe a little bit less relevant to this scenario, but could possibly be, so I want to include it anyway. Eliciting commitment in front of other people if possible. So if the client really does want to come out, but is also nervous about it and is maybe out to some other people already, saying something to like their best friend of like, I'm going to come out to my mom tonight, can increase the likelihood that they do that. And again, this I think is most important in a situation where like the client maybe wants to come out and they've, done the other sort of action planning and risk assessment, but also have some anxiety around it. And I think that's pretty common. But again, sort of not necessary in a lot of situations. And then inoculating against shame if the client does not persist or proceed. So just highlighting for the client that even if they want to come out, but like ultimately don't in this moment of time, that like that doesn't mean that they're cowardly or doesn't mean that they're like a wimp or something like that. That like it's a really stressful process and they should sort of proceed at the pace that is most safe and helpful for them. So one tool that can be helpful in terms of identifying how ready a client is to sort of move on to that next step is called the readiness ruler. And the readiness ruler is a tool and conversational method where you ask the client to rate on a scale from 1 to 10, the importance of making a change, the willingness to make a change, how committed they are to making the change, the confidence they have in their ability to make the change, and how ready they are. And you don't necessarily need to use all of these rulers, but depending on the situation, select the one or two that seem most topical, just to get a sense of how far along or sort of how strongly the client is thinking about making the change. Because I think sometimes it can be a little bit hard to tell without actually trying to scale it in some way. So one way that one might present the readiness ruler is on a scale from 1 to 10, with 1 being not at all ready and 10 being extremely ready, how ready are you to come out to your mom? And say the client says, I'm a 6. Then the clinician might ask something like, why did you say a 6 and not a 4? And asking that question will elicit from the client some of the reasons that they are feeling ready, which potentially might make them feel more encouraged and more comfortable proceeding if that's what they choose to do. But I do think big picture with motivational interviewing, a big reason it can be a valuable tool is it does provide the client a lot of opportunities to self-reassure for a decision that feels right to them, but they're still anxious about. Which again, I think I want to affirm a million times that because of the uncertainty that is just always associated with coming out, there's often a fair amount of anxiety, even if it does seem to be the right thing for the client to do. Then we have readiness ruler continued. If a client decides to come out, so like, I'm ready, they'll likely start exhibiting some signals of readiness, such as high amounts of change talk, like, I'm going to do this, I really want to do this, here are the reasons I need to do this. We might see them start to take steps, again, maybe telling folks in their more distal social network, maybe sort of writing down scripts about what they might say, maybe thinking about sort of a safety plan. We'll talk more about safety plans in just a little bit. And then we'll see sort of higher rates on the readiness ruler. And you may use the readiness ruler multiple times. And if that number increases over time, that's a sign that they might be feeling more ready. Again, our goal isn't necessarily the end of this process for them to come out. So if it seems as though through this process, the client is like, no, I'm not actually feeling that ready, that's totally fine. We sort of want to support the client with that decision as well, and figure out how they can feel sort of most safe and comfortable and mentally healthy given that decision also. And once these things start happening, we see change talk, folks taking steps to say they're ready. Planning becomes the next phase in the MI process. So action planning, I think this is a pretty common tool in a lot of clinical approaches. That once a change option appears to be the most desirable, the planning process involves using all of the same tools we've been discussing. Specifically, I think open-ended questions and reflections to continue to sort of elicit the client's sort of motivation to make change and the reasons they want to make that change. as well as their own sort of expertise in developing a plan. Again, we're sort of dealing with what is always an uncertain circumstance, but the clients probably know their life and plausible reactions of people around them better than anyone else. And again, big picture, we're not attempting to try to instill external motivation or persuade the client to adopt a changed plan. We really want that to come from the client themselves. Because again, we really don't have definitive information about how this is going to go or what's going to be most beneficial for the client. So particular aspects of action planning involve reflecting and summarizing the plan, troubleshooting the plan by working with the client to identify potential obstacles and ways of overcoming those obstacles, and then getting more specific. So when might a disclosure conversation happen? Where might it happen? Who do you want to be present? What are you going to say? What are some questions you expect you might be asked? How might you want to answer them, etc. So really trying to, as much as possible, come up with like a clear strategy for what this might look like. So goal attainment scaling can really be useful in helping the client to see progress that they've made, particularly if they don't maybe fully implement their plan. So it seems like a youth really wants to come out and maybe has like come out to some friends, but like had wanted to come out to their mom, but hadn't done so yet. And I think often when folks set a goal and maybe don't fully achieve that goal, there can be a lot of shame and a sense of like beating oneself up about it. And so this can involve just strategies for noticing the progress the client has made. So one example might be setting up a point system of like, your goal had been to come out to 3 people this week. And you didn't quite make the goal, but you did still come out to 2 people. And so that's sort of 2 points in this system. And for some clients, I think this resonates really well, and other clients find it kind of hokey. But I think a really big important piece of this is to validate the progress that is being made towards the goal, even if that goal isn't fully actualized. And then lastly, safety planning. And motivational interviewing has some tools for this, but I think you all likely in sort of your agencies and other practice experiences have tools for safety planning as well. So I'd say big picture, my point here is that it's important to plan for safety and use the tools that you have and are most familiar with to support in that safety planning. Some things that come to mind as potentially important things to consider as to what to do if parents may become violent or force the youth out of their family home, or if the youth were to experience bullying. So thinking about contingency plans for if some of those risks that we all know can establish were to occur. So I know I had a client going through a pretty similar process maybe 6 months ago, and the safety plan, and this client was a bit older, so they were in their like early 20s, but still lived at home. And so the client really wasn't sure how their parents were going to react. But what they did beforehand was to have a bag packed with necessities in case it seemed clear that they weren't able to stay in their home. And then they had identified a relative in the area who would be willing to host them, which, I think involved coming out to that like much more likely to be supportive relative first. So that was a key element of the plan. I think the other piece of this does also involve using all of those compassion, client-oriented skills along the way, because like this is a big deal. The client is ultimately made the choice that coming out and disclosing their sexual orientation was really critical to them. And, we're talking about some big risks here that they loved their family and really didn't know how they were going to react. And just sort of affirming how difficult that uncertainty is, and sort of affirming how difficult that like concern about loss is. That this does really need to sort of involve all of that warmth and compassion we try to bring to other clinical encounters. Another example is a client may want to identify a trusted school employee to intervene and provide emotional support if the client were to experience bullying. So going back, I had another client who had a really good relationship with their French teacher. And their French teacher was kind of the known person in the school who, when things would come up, would either take it up directly with students who were maybe engaging in bullying, or rope in other teachers or counselors to intervene as well. And it brought a lot of comfort to the student just to know that they had the support of this educator in the environment that, you know, unfortunately wasn't particularly affirming for them. So to summarize what we've talked about so far, the tools in motivational interviewing that I think can be relevant here, the decisional balance, helping folks to weigh the benefits and drawbacks of different coming out options. The change menu to highlight different potential changes that can be made. One could come out to everyone in their life, one come out to a few people, one could come out in a public location, one can make sure to have like a trusted friend or a companion with them when they come out. There's the elicit, provide, elicit framework that can be really helpful for if you do think you have some helpful information that might be useful in making the decision, such as different options for coming out or different risks and benefits, seeing what the client already knows about that, asking if they want your opinion, providing brief, relevant, and targeted information, and then asking the client what they think about what you just said. Readiness ruler that can be helpful for assessing how ready the client is and to get a sense of what things are contributing to them being ready. So in this case, if they say they're 6, asking a 4 provides some information about reasons they're thinking that they're ready. If they say 6 and you ask about why not an 8, you get information about the reasons they're maybe potentially not ready, and you can sort of troubleshoot using that information. Action planning, so actually coming up with a specific plan. There are a fair number of motivational interviewing worksheets that can be topical here that can help identify some of the specific components of a plan, like time, location, people involved, strategies, steps to take leading up to the plan. Goal attainment scaling tool. So this can help clients to see a goal is not just dichotomous, I came out to everyone or I didn't, but rather as sort of a continuum of like steps towards the goal, which I think can be really helpful in helping folks to not feel as demoralized or sort of overwhelmed with like guilt or shame or embarrassment about maybe not progressing as far as they had intended in the conversation. And then safety planning, try to identify based on possible risks of the situation that are tailored specifically to the client. What can they do to mitigate those risks? So there are people that can support them, or there are places they can go. Are there, you know, sort of broadly speaking, safety, just someone they can talk to, maybe you, about the stress of the process. And again, sort of just really affirming that like, this can be a really stressful decision, and also affirming that for some folks, it maybe isn't as stressful as a decision, but just being open to sort of the range of reactions and trying to provide a sort of safe and empathic space to process all of difficult things that can potentially come up and the uncertainty around that. So now I'd love to give folks an opportunity to practice. So what I'll do is I'll present a vignette and then maybe give folks about 3 minutes to sort of jot down some thoughts about how they would respond. And once those 3 minutes are up, have folks enter into the chat some of the possibilities of things that they might do. So in terms of reading the vignette, let's see. Sorry. We have a tech problem here. Okay. So Trisha is a 15-year-old non-Latina white female. She's been in kinship care with her aunt for the past 6 months while her mother receives treatment for her alcohol use disorder. Trisha has described herself as a tomboy. She likes sports and prefers to keep her hair short and wear baggy clothing. People at school have teased her about being a lesbian, though she doesn't actually identify as a lesbian and has never sort of used that language to describe herself. Trisha is attracted to a girl at school. This is Trisha's first crush, and she's experiencing a lot of anxiety about the crush. Very normative stuff for adolescents. She doesn't know what the crush means about her sexual orientation, but she would really like to tell the girl about her feelings. She's worried the girl won't reciprocate these feelings, and that if her peers found out, the homophobic bullying might intensify at school. Trisha's also worried that if her aunt found out about her attraction to the girl and potential relationship, Trisha doesn't believe that she would experience physical violence from her aunt, nor does she think her aunt would kick her out of their home. But her aunt is really religious and has expressed that she believes gay people should try to change their sexual orientation. So Trisha worries that her aunt would pressure her to talk to the minister, who she suspects might try to encourage her to pray to stop being attracted to women. So yes, I'd love for folks to take the next 3 minutes. We'll say wrap up at 11:54, or I guess 12:54 Eastern time, 54 after the hour, to like just jot down some notes to yourself. And then once we hit 54 past the hour, would love for folks to enter some of their thoughts into the chat. So I'll give you the next 3-ish minutes to write down how you might approach the situation using motivational interviewing tools. Great. So folks are starting to enter in some of how they might approach the situation. If you haven't already, but feel like contributing to that conversation, please feel free to enter a few things. We'll give a couple more minutes for that. Excellent, and feel free to continue typing this, but as I summarize, some of what folks are saying, a lot of really excellent content here. So some things that came up, I think, are really good things that maybe weren't specifically part of this presentation, but are really important to think about. One is sort of navigating just like general perceptions of sexual orientation, including that, sexual orientation can be fluid and change over time, but folks don't necessarily sort of think about it in that way. So I think also getting a sense of like how Trisha is feeling about having this attraction to a girl, what she sort of thinks that means about her, if she's having sort of discomfort labeling herself as like a lesbian or bisexual, something like that, that like that's totally okay. That like a lot of folks experience attractions to folks of the same gender, but don't necessarily adopt in a current moment or like ever particular identity labels. And so that's totally fine and normalize that because I think folks often don't necessarily get that message. I think there's also some discussion around potential internalized homophobia. So helping get Trish understand what Trish's opinion is about her attraction if she's feeling shame about that. And sort of helping Trisha to assess just like how she's feeling about her sexuality in her own right. And then there's the actual sort of application of some of these motivational interviewing tools. So looking at benefits and drawbacks of having this conversation with this girl she's interested in. Some folks highlight some important things about like, we don't know much about this girl. How do we think this girl will react? There are a bunch of different possible uncertainties there. Like this girl might possibly tell other people. This girl might potentially bully Trisha. This girl might be like, oh my gosh, I love you so much. I want to be in a relationship with you right now. Which is on one hand, likely what Trisha wants, but also could perhaps bring about sort of extra risks because if Trisha enters a relationship with this girl, there then likely would end up being more people who become aware and sort of more conversations and risks and benefits associated with entering a relationship. So like they're just like a bunch of different variables. I also liked folks were discussing connection to more supportive resources. So perhaps we don't know much about from this Trisha's religious leanings, but if Trisha's religious and religion is something that's really important to her, and we're concerned based on what we know about Trisha's aunt's church, it may be that Trisha should also start looking for an affirming faith community. So just a bunch of different variables to weigh. Folks, I think, are really highlighting the importance of using open-ended questions, affirmations, reflections to sort of navigate this process. You have the suggestion of identifying potential mentors or sources of support at the school. Such good content here. Safe people she could talk to about any bullying she might be experiencing. I think, again, sort of highlighting that all else aside, sort of anytime there's an expression of romantic feelings, there are just a wide range of outcomes that can occur. And so helping sort of Trisha be prepared for a few of those different possibilities. And that some of those challenges relate to sexual orientation and sort of the oppressive world we live in, but some are just like young love can be risky and scary, and we sort of don't necessarily know how one of these conversations is going to play out. You have safety planning. One phrasing of the question of what would you like to see as you move forward? Discussing how she feels about herself. Again, some of coming out, like the actual disclosure is one part of this process, but often folks have a lot of other reactions to discovering that they're attracted to people of the same gender. Validating Trisha's concerns and feelings. I really like the point that teenagers often feel very acutely how others respond to them and are particularly sensitive in some cases to judgment. And so just being aware of Trisha's like developmental stage. But yeah, I think that's it for sort of this exercise. But yeah, again, I think you all are doing a really nice job of thinking about how some of these tools might be applied in this particular situation, but also thinking more broadly that sexual orientation is more, or coming out involves more than just disclosure. It also involves, in many cases, working through an understanding of like what particular attractions or identity labels mean for someone, working through internalized homophobia and negative perspectives about sexual orientation. I think there's some cognitive behavioral interventions that focus on using CBT tools like cognitive restructuring to help folks try to modify some of their internalized homophobia. But big picture, they're just, in addition to the tools we've talked about today, a big range of other clinical tools that are sort of relevant in navigating this like broader picture of what Trisha might be going through in this situation. In addition to just like all of the other things in Trisha's life. That, you know, she's also probably has a pretty challenging relationship with her mom and has had a pretty volatile like living situation. That this is one part of Trisha, but there's sort of a lot of other things going on too that also will sort of need attention throughout this process. Great. So just some resources that folks can access later. I recommend going to glad.org/resource list as they're listed there. But some of the resources that are recommended there that I think can be helpful involve the Gay, Lesbian, Straight Education Network, the Gay Straight Alliance Network, LGBTQ Student Resources and Support Point Foundation. I really like, in particular, the Trevor Project, as that can be a hotline that LGBTQ youth can call, typically around suicidality, but they're pretty open to talking with LGBTQ youth about other things as well. So yeah, just to be informed about some of the other resources that are available. Also, there are often local resources. So I grew up in the state of Iowa, and the Iowa Safe Schools Coalition provides resources, but like lots of local areas do have their own sort of local resources as well. So just I encourage being aware about these sort of national resources, but also resources that are available in your community. Oh, and PFLAG, I think that one will definitely come up in the next session you all participate around caregivers, but I think it can be really valuable for caregivers to have networks as well, particularly for caregivers who are confronting more challenges, even their own internalized stigma stuff, but also caregivers can experience sort of this rejection as well, can experience, you know, a lot of empathy and sort of fear for their children. So there are just a lot of reasons that caregivers can also benefit from support, and PFLAG chapters are often a really good source of support for those things as well. All right, so I think that was all for the presentation portion. If folks after this presentation want to reach out to me for whatever reason to ask more questions, feel free to email me at brianna.mcgeough, briana.mcgeough, MCGEOUGH, at ku.edu. And this presentation goes till 30 past the hour, so we have about 25 minutes for questions.
Yeah, Dr. McGee, thank you so much for such a great presentation, and particularly the case study and, you know, being able to actually go through that and see it in practice. As you mentioned, we do have a few minutes for questions. We have a few questions that came in, but anyone please send in all of your questions now, and we'll do our best to get to them before 1:30. So the first question that came up was, how do you support LGBTQ plus youth when they haven't talked about their sexual identity in sessions?
Sure. So is this a situation where it, I guess, hasn't come up at all? I do encourage trying to sort of open the door a little bit. Like I encourage having inclusive intake forms, so that like that can provide an opportunity for folks to like indicate perhaps they're questioning, even if they're not necessarily feeling as comfortable bringing that up verbally. I think it's fine to bring up some like open-ended questions about asking pretty directly about what folks' sexual orientation is. That, you know, I think normalizing like sexuality, particularly if you're working with like an adolescent, sexuality can be, you know, sort of a big thing on the minds of adolescents. Is there any sort of anything going on with like the relationships in your own life? And I think sometimes these questions can even help like heterosexual youth who are navigating some of these challenges around like, I like somebody, how do I ask them out? Can sort of just give permission. to discuss those things. And in many cases, I'm be like, no, nothing I need to talk about relationships or dating or sexuality right now, in which case sort of move on and focus on other things. And in some cases that might open the door to having more in-depth conversations.
Awesome. That makes a lot of sense. Uh, and it's interesting. You did bring up open-ended questions. One of the comments that came in and subsequent questions was, I think open-ended questions are great. However, I have noticed sometimes when I will ask clients open-ended questions, they will just say, I don't know. Does MI have any strategies or suggestions for how to address clients that say they don't know?
Yeah, so, again, I think it depends on some of the specifics of the question. I do think that's a place where the elicit, provide, elicit framework can be really helpful, as well as this is, I think, a more general tool of like just sort of tentatively voicing a hypothesis. Like, I'm wondering if blank is going on for you. Like, I think the thing we want to avoid is asserting that we know what's going on for someone, but we might have a pretty good idea based on other things they've said. And so I think it's often wise to, as it's suggested in the elicit, provide, elicit framework, be like, I've got some thoughts. Would it be all right if I shared them with you? And then asking for feedback, or just sort of tentatively being like, I'm wondering if blank might be going on. And often folks will sort of bounce back from that. And sometimes they'll be like, yeah, absolutely, I want to talk about it. Or like, no, that's not it at all. Or in some cases, could potentially even feel sort of offended by the assertion that was made, and then one can process that. But it is okay to bring sort of your own perspective to these conversations. It's just really important to make sure that the client has an opportunity to sort of respond.
Thank you. The next question that we have is with regards to staff. So, how do you handle staff that refuse to address youth by their preferred name or gender?
Really good. And I wish this issue didn't come up, but it comes up a lot. And I think, there's some philosophical differences in terms of how to approach this issue. I tend to prefer to sort of work up the ladder of sort of drasticness. So I prefer to initially assume that there's a mistake, so maybe try to gently provide a little bit of education around, oh, this person actually uses they pronouns. They've been very clear that that's how they want to be referred to. And if sort of that like gentle reminder doesn't work, being a little bit more forthcoming then about, no, this is really important, highlighting some of the mental health reasons that like using the right name and pronoun is a really important part of mental health care for providing support. And, not using that can really sort of damage rapport. So I think trying to sort of initially start with like leveraging some of the values and providing information. And then depending on the clinic that you're in or context, many clinics have specific policies around this, and like states sometimes have civil rights protections around this, that if the sort of more gentle try to appeal to their desire to be like good and supportive professionals doesn't work. Being more forthright about like, no, this is the agency policy, like there are laws around this. And, potentially if things still require further escalation, like consulting HR. So I think it's best to sort of start at like the more gentle portion of that, but like the reality is this is really important in many cases is, if not against a policy, potentially illegal, and sort of using those like other resources as well. Because I do really want to highlight the importance of respecting youths' pronouns and names. And the extent to like literally doing those things is suicide prevention, and can have really big mental health effects. So I just want to highlight that these conversations are awkward, difficult, but they're also really, really important and like consistent with the values of our profession.
Perfect. Thank you. And, along the same lines, some of the questions that came in were with regards to working with family members and caregivers. So, do you have any resources on ways to help family members begin to utilize correct pronouns if they are not accepting of the child?
Really good question. Like, I do think PFLAG is a promising first step. I think sort of some of those same conversational tools, also really important about sort of highlighting how important it can be for their child's mental health. I'm seeing some questions pop up here around parents who are concerned that something might be some sort of like phase. And the reality being that, like, particularly with kids, things change. That it's possible that like a youth might identify as trans for a while, but ultimately be like, no, I don't think that's actually right. But I think sort of affirming that like just because someone identifies in a certain way now doesn't necessarily mean that that's going to be forever. It could also be forever. But being accepting, even if that changes over time, is still really important. That like, even if a youth is identifying as trans now and comes to not identify as trans later, not experiencing acceptance in that sort of period of their life is still potentially really damaging and still increases risk of mental health problems and suicidality. And that one doesn't necessarily need to make permanent decisions. So I think something that's been coming through the legislature a whole lot in my residential state of Kansas, but like a bunch of states, has been around providing medical interventions for trans kids. And there's this like sense that like children and teenagers are trans children and teenagers are like having surgeries to like change their anatomy. And like that's just not happening. That the primary intervention there tends to be hormone blockers so that the youth doesn't go through puberty and then can make decisions later on when they reach adulthood about whether or not they want surgical intervention. So I think a lot of this can also be sort of clarified around education. That some of the things that they are worried their kid might be experiencing, like a drastic surgery where they change their mind as like a preteen, just isn't the medical practice. In terms of specific resources, yeah, I think PFLAG is a good place to start on that. There's kind of hard to get one's hands on. I think there's a Louis Theroux documentary. He's a BBC journalist who I think made a documentary about trans kids that I found to be really illuminating. But beyond that, I don't have as many specific resources. I suspect the presenter next week who's focusing on caregivers will have a little bit more to add there.
Great, thank you. One of the questions really is around the use of tools, and I know you just brought up some. Does the use of tools vary across ages? So thinking specifically of middle schoolers versus high schoolers, and within that regard.
Really good question. So I think there is unfortunately less research, as we saw with MI with younger folks. So there's like a baseline body of literature that suggests that once folks reach their teenage years that MI tools can be used, but it's not particularly nuanced at this point. I also sort of, in the interest of transparency, primarily work with adults myself. So I've primarily applied these tools with folks who are high school or later. What I do know is that the more concrete tools are best for like younger ages. That some of the more like abstract cognitive processing is harder for early adolescents. So I think more of the concrete, like I think the cost benefit analysis, decisional balance kinds of tools have a little bit more of an age appeal. I think things like the readiness ruler can be maybe a little bit more challenging to use with younger folks. I do think looking up sort of MI resources generally for younger age groups and sort of using the same sort of framework we've talked about applying them can be useful. Like I think even little things that sort of preserve the general principles, like having more visual tools. I know some MI workbooks for working with like younger folks just involve a lot more like illustrations that can help. So I would say I would encourage doing a little bit of homework depending on sort of the specifics of who you're working with about like what are the MI tools and resources that exist for like that particular age group, and then sort of applying some of the same logic for then adapting those more specific tools to particularly younger folks.
Great, thank you. Just wondering, can you say the name of the documentary that you mentioned 2 questions ago? We had a few folks that were asking.
Yes, gosh. So Louis Theroux is the documentarian, Louis space Theroux. And he's a documentarian through the BBC too. I actually can't remember the specific name of the documentary, but I think with that information, it's probably pretty Googleable. He specifically talks to folks in the San Francisco Bay Area. So I think, there's definitely some caveats there in terms of there are just more resources available in San Francisco Bay Area than almost anywhere else. But I think can be still just like an empathic perspective. But yeah, there are a few general documentaries, but that was the one I had watched most recently that I thought did a nice job. But yeah, sorry, I can't remember the specific name of it.
No, that's perfect. Thank you. We could definitely find that and send it out to folks.
Awesome. Thank you so much, Jason.
Yeah, of course. Okay, getting back to some of the questions that we did have come in. Uh, what do you say to families about supporting their LGBTQ plus child when they have strong cultural, religious, or gender beliefs against their identity?
That is always such a difficult situation. I think the most important thing is to appeal to the family's values. Was sort of an acknowledgement that the reality is that rejection is linked to like mental health risk. So the thing one wants to avoid doing is like shaming the caregivers for those beliefs. Because the reality is at the point that they're talking to you, there's at least some window of like wanting to be helpful there. And like people generally really care about their children. I'd say almost always really care about their children. So I think trying as much as possible to like identify what's important to them about being a good caregiver and trying to like appeal to that. I think affirming a lot. So not affirming like the homophobia, but like affirming that like, oh my gosh, this is really a difficult situation. Like it's so clear how much you care about your child. Here are some specific examples about ways in which you seem to really care about your child. So like doing a lot of affirmation. And then I do think the importance of highlighting that like it is unfortunately really detrimental for kids' mental health to not experience some amount of support. So I think a little bit of education around that can be helpful. I think even actually, and you'll get more of this in a couple of weeks, but trying to maybe use some of those motivational interviewing tools to like highlight the ambivalence, reflect back anytime you do hear something sort of affirming, help them sort of weigh the pros and cons of different ways of responding. Like I think a lot of the tools that we've talked about can also be used with parents as well. But yeah, I think big picture, the thing we want to avoid, even if it can be really frustrating and difficult. I think particularly, I imagine some of us here hold queer identities. Like it can be really tough to hear, I think, pretty negative homophobic and transphobic things. But trying as much as possible to like affirm the like loving and like human parts of what you're hearing as well. And as much as possible, try to like elicit from the parents the importance of trying to be affirming.
Awesome. Thank you. Another question came in really regarding identity. So, when working with youth or a client who really has negative feelings towards their own identity, even if the provider does not, how do you work with the youth over their conflicted feelings?
Yes, so I think one of the things, as much as possible, depending on sort of the benefits and constraints of your environment, is to help that person to potentially meet other LGBTQ people. Because I think often what some of that is sometimes coming from are some like pretty strongly held and unquestioned stereotypes about what LGBTQ people are like. And so if there are community events happening or like, I don't know, some sort of like message board that you know of or familiar with, this becomes easier post-COVID when people can go places. And I think getting a little bit of exposure to other LGBTQ people and often sort of seeing sort of the humanity can be really advantageous. So I think that's a step I would recommend. There are there's a pretty scant body of literature, mostly on adults, about how cognitive restructuring can potentially be applied to internalized homophobia. So if a youth provides a sort of homophobic view, trying to do the standard evaluation of like, what's the evidence that supports it view? What's the evidence against? What are the benefits of holding this perspective? What's the benefits of perhaps holding a slightly different perspective? I think can also be useful. Books are another possibility. Julianne Peters, particularly for like lesbian, bisexual women, has a number of like teen fiction-y books that I think, now I'm sort of pulling back from the evidence base a little bit, but I think sort of drawing from personal experience, some exposure through literature can also be helpful. So I think really, yeah, just cognitive tools for doing some cognitive restructuring, as well as just trying to get a little bit of exposure to the community as well, because I think that can sometimes be a powerful tool for combating stereotypes.
Absolutely. Another question that we did have come in is, how do you work specifically with youth who identify as queer or pansexual, but don't identify as gay or lesbian? Does anything change in terms of your approach?
Overall, no. I think big picture, the approach is the same. I think some of the challenges can be different. That I think one, unfortunately, we live in a world where I think often even like the gay and lesbian community can be pretty exclusionary towards bisexual and pansexual folks. I think also, unfortunately, the like community of like lesbian, gay, bisexual folks can often be kind of exclusionary to trans folks. So I think sort of just being prepared that there might be biphobia and panphobia in what are supposed to be queer affirming spaces, transphobia as well. And, you know, potentially needing to process some of those experiences with folks. I also think some specific messaging can come up around specifically bisexual and pansexual identities. Some stereotypes about, oh, it's only a phase. Oh, you just need to find the right person of a different gender. Oh, it just means that you're promiscuous. I think there are some like specific stereotypes that members of specifically the bi, pan, sort of broadly queer community can experience. And so I think being prepared to talk about those a little bit using, again, some of the same tools. I think like the tools are the same, but some of the specific experiences can be a little bit different based on what the stereotypes are, and unfortunately, at times exclusion in LGBTQ spaces.
Thank you. And another question that came in is, would you change your approach for a particular youth who is still questioning their own sexual identity?
Yes. So again, I feel like in some ways it's the same tools, but just like a different presentation and application of them. So one can still use the decisional balance for questioning, but it's in that case not a decision about to disclose or not to disclose, but sort of evidence for and evidence against. Something I do recommend, as much as I think it can be tempting to just do evidence in favor of the idea that I'm, say, heterosexual, evidence in favor of the fact that I identify as LGBTQ, is also doing sort of the flip of that. So I guess evidence for being heterosexual, evidence against being heterosexual, evidence for being LGBTQ, evidence against being LGBTQ. And I think the reason it's important to sort of do all four quadrants of that is that it can, I think, be almost sort of reinforce heteronormativity if one just sort of does the first two of those. Sort of one emphasizes heterosexuality as the reference point, which is generally how our society works, but I think still sort of forecloses possibilities. Because I think the reality is that, like, in many cases in these conversations, the evidence for heterosexuality is largely that that's just like what society tells you you are. And so I think it can be helpful to draw information from all four of those like quadrants. I also think a lot of questioning does end up being sort of tied to stereotypes that like, oh, there are all these sort of negative stereotypes about LGBTQ people. I'm not, say, some of those things, so I couldn't be an LGBTQ person. So I think some of the same tools about trying to get a broader understanding of the community can be really helpful there through like attending events and reading literature and all of those kinds of things. I think also just normalizing that questioning is a thing. Like personally, I spent a lot of time in the questioning phase. And I think that was largely actually because of just getting a lot of pretty negative messages about being an LGBTQ person. But also just sort of normalizing that like, it's okay to not know. A lot of folks don't know. We don't necessarily talk about that, but that like is a really common and normal thing. So I think a lot of normalizing about that as well. And I do think sometimes questioning does get resolved through some experience. So I think in some cases one can sort of try to like look at pro and con lists all day long, but like actually potentially going on dates with people one's interested in and things like that can help provide some clarity as well. But yeah, I'd say big picture, sort of the same tools, but I think what the question is and sort of what the goals are can be a little bit different for questioning versus something that's like, as questioning is often a more cognitive process versus coming out, which is a more behavioral process.
That's perfect. And I think that was the perfect question to end on. I do want to say thank you. We want to let folks know of a few upcoming events before you log off. So part 2 of this webinar series, Applying MI as a Therapeutic Approach to Support Adjustment, will happen on April 14th at 12 p.m. Again, that webinar is an hour and a half. We do hope that you sign up through ctacny.org. And we also have a self-learning guide on the CTAC MCTAC Self-Learning Center that we'd like everyone to take a look at. So you can see that at lms.ctacny.org, along with a number of other resources. So with that, we do want to thank you all for attending today's presentation, and especially thank you, Dr. McGue, for just your expertise and really answering all of our questions extremely thoroughly.
Yeah, thank you so much for joining. It was a real pleasure to chat with you all and really thoughtful feedback and comments as well. Thank you.
Yeah, thank you. So as always, please complete the feedback survey at the end of the webinar. And the recording of today's presentation as well as the slides will be up on the CTAC website before the end of the week. All right. Thank you, everyone. Take care.
Bye.